The aesthetic procedures or the cosmetic surgery procedures essentially that get done can be via a plastic surgeon. The difference between a plastic and reconstructive surgeon is that, not a difference, but plastic and reconstructive surgeon in the sense is they also, fix and do reconstructive work after, let's say, someone's had breast cancer. They've had to remove the breast, which we call a mastectomy, and they've had to go and reconstruct the breast. So that's reconstructive. Now, not all plastic and reconstructive surgeons do cosmetic surgery. So you can be reconstructive and you can do flaps and everything in the hospital and not necessarily be doing implants or any other sort of cosmetic work. So the difference between reconstructive work and cosmetic work is reconstructive work, let's say you're in a accident, in a road accident, and you've got disfigurement, so that's reconstructive. You've had breast cancer. So any ailment or trauma that you've had that needs to be fixed, and the scars and issues that you've had with it is reconstructive. Whereas aesthetic or cosmetic is purely that you have something that you want to make better. So that's what we say, augmentation, enhancement. It's we're enhancing what's already there, or body sculpting. Okay, so it's not. So it's an aesthetic from point of view. So essentially, throughout the world, it's the same system. So you can have plastic and reconstructive surgeons who don't do aesthetic. You have plastic and cosmetic surgeons who also do a bit of reconstructive work, but at the same time do aesthetic work. Okay, cosmetic surgeons in general, majority of them, do the aesthetic aspect of it, but then you can have cosmetic surgeons who are also ENT surgeons who also do other surgeries, and they also do the rhinoplasty. So it depends on the speciality you're in. The point I'm trying to make is that anyone that does cosmetic surgery should have a surgical background. So there's a lot of stuff in the media, and there's a lot of confusion amongst patients on what the definition of the cosmetic surgeon is. Now, there are cosmetic surgeons that are actually not from a surgical background. So they can be emergency doctors, they can be GPs, they can be anaesthetists and everyone like that. So you need to ensure from that point of view that when you go and see someone, whether it's a plastic surgeon or a cosmetic surgeon, that they need to have, in my opinion, a surgical background, because doing the surgery is one thing, but if there are complications, then the surgical background cosmetic surgeons would be better trained at dealing with that. Okay, as I said again, when things are going fine, no problem. It's when things go wrong. So you need to prepare for not when things are going right, when things are going wrong. So that is the difference between on how that happens.